Medical aid industry has been stagnant over the last few years as membership numbers dwindle due to tough economic times. But the government employee medical scheme GEMS has been adding numbers. More than 30,000 new members signed up with the scheme last year. GEMS believes that its resilience is related to the type of offering it has, which it believes is 27% cheaper than its competitors. But GEMS says challenges such as high interest rates, load shedding and high inflation are likely to have a negative impact on the scheme. The scheme recorded principal membership of over 800,000 at the end of the 2022 financial year.
We know that budgets are under pressure. So when their budgets of families are under pressure, people look at where they can cut. And usually, people look at insurance in general, and depending on their circumstances, whether they're sickly or generally well, they'll also look at a medical aid.
GEMS has received 400 million rand from the National Treasury to beef up the scheme's reserves, and it intends to bring in-house the services that were outsourced to improve efficiencies. The scheme held total investment funds amounting to 28 billion rand from 26 billion in 2021. It has attributed the huge reduction of its surplus to more demand for medical care.
If you look at the previous year, we were reporting in 2021, where the surplus was, as you indicate, about 4.3 billion. During that year, due to COVID, we had the utilization of hospital care for non-emergency procedures. It went down. While we had a lot of hospital admissions for COVID-related costs, people avoided going to hospital, especially for non-emergency procedures. And as a result, what we find that the utilization that would have normally happened went down, and hence we had a surplus that is much higher than we had budgeted for.
GEMS has reiterated its commitment to the National Health Insurance Bill. It's vowed to continue to offer efficient and affordable health care to its members, who are mostly public servants. Naledi Matlapeng, SABC News, Johannesburg.